And we're live. Hello. Welcome to the April 2020 Walk with the Doc Kids Time Las Vegas. I am Dr. Terrence McAllister, and I'm a pediatrician with Desert Valley Pediatrics here in Las Vegas. But I am also the coordinator for the Nevada chapter of the American Academy of Pediatrics Walk with the Doc Kids Time Las Vegas group. Now, for about the past 4 years, the Nevada chapter of the American Academy of Pediatrics, or the Nevada AAP for short, has been hosting these walks. On the second Sunday of every month, we get together to have a little talk about an important health topic, and then we all go for a walk together. Normally, we do this down at Springs Preserve in Las Vegas. During the hottest months of the year, from June through September, we meet up at Mount Charleston Spring Mountain Gateway Visitor Center to try to escape the heat of the valley. But today, April 12th, 2020, we're doing things a little bit different. We're doing things with a live feed. So it's a little bit different for all of us. There might be some missteps along the way, but just kind of bear with us, and I think we'll get through it. And I think it's important that we're doing this. When my family moved here in 2018, one of the first things that we did was join this Walk with the Doc group. And it quickly became a habit for my family to get together on the second Sunday of every month with fellow pediatricians, patients, and their families in order to have a talk about an important health topic and then to go for a walk together. Over that time, a lot of you have become friends to us. And we're missing you today because we can't be with you physically together. But I think it's important that we still stay connected in our hearts and in our minds, and that we do this walk virtually. So here's how this is going to work. All of you on Facebook have a chat box, and I encourage you to use that chat box to communicate with each other, as well as to ask questions of me. And I'll try to answer as many of the questions I can during the walk today, and those that I don't get to, we'll answer in the follow-up email that we'll send out to everybody. Now, before I get to our topic for today, which is the 2020 census, I want to talk a little bit about what's keeping us apart today. So right now, the coronavirus, which is causing the illness called COVID-19, is circulating across our community and across the world. And just for now, that's making it unsafe for us to get together. It's unsafe for people to gather at school, at work, or even for fun walks in the park. But that is just for now. But it is a very dangerous virus, and there are certain things that we need to do to protect ourselves from it. One of the superpowers essentially that we have to protect ourselves is what we're doing right now, staying apart from each other. So keeping distance from other people helps keep the virus from spreading, and that's a very important superpower that we all have to protect ourselves from this virus. But it's not the only power we have. There are other things that we can and should be doing as well. For instance, washing our hands. You should be washing your hands a lot these days. When you wash your hands, you want to wash them with soap and water if you can. If not, hand sanitizer also works, and wash them for at least 20 seconds. You want to do this every time you eat, every time you go outside, every time you go to the bathroom. It's very important to be washing your hands a lot right now. Our friend Elmo on Vegas PBS has a video about hand washing, which we will send out to everybody after this talk so that the parents can share it with their kids. Another superpower that we all have is to not touch our face. And I know as soon as I say it, everybody feels their face is itchy and they want to touch it. But it's important to try not to touch your face because that's how the virus gets transmitted. If you have a mask or your family can make a mask, wearing a mask when you do have to be out and around people, like if you have to go to the grocery store, you should do that as well. That's another superpower that you have to prevent the spread of the virus. Now, there is one more superpower that we don't have yet, but when we get it, it'll be our greatest power against this virus. And that power is a vaccine. Now, I know vaccinations are not kids' favorite part about going to the doctor, and I don't blame you for that. But I've been a doctor for over 20 years, and in those 20 years, I have given a lot of vaccines. Now, every vaccine that I give in order to protect a child, to protect a patient against a very serious illness caused by a virus or bacteria. And the vaccines are very effective at preventing those illnesses. Now, just for now, we do not have a virus against the coronavirus. We do not have a vaccine against the coronavirus. But there are some very smart scientists and doctors who are working very hard to get that vaccine for us. Now, once we get that vaccine, it'll be very helpful in fighting this virus. But here's the problem. We have to wait for it. And waiting is hard. In fact, that's the title of one of my favorite Mo Willems' Elephant and Piggy books. In that book, Elephant has to wait for a surprise from Piggy. And it's very hard to wait, but in the end, it's worth it. And the same thing for this vaccine. We have to wait for the vaccine, but in the end, it'll be worth it. And while we're waiting, we have to use our other superpowers. Stay away from other people. Wash your hands a lot. Try not to touch your face. And wear a mask if you have one. All right. Well, that brings us to the topic for today, which is the 2020 census. Now, the census is undertaken by the government once every 10 years, and the idea of the census is to count every person living in the United States. We count every person in the country, but we break it down, every person in every state, every city, and every town. And this is very important. The United States is a great big country, and we have a lot of resources. Resources being money, vaccines, and other things that people need to have a healthy and successful life. And the only way that the government knows how to distribute these resources to everybody who needs them is for us to know how many people live here and to know where they live. And so every 10 years, the government, through the census, counts every person. Now, here's the problem. The last time we did this count, which was back in 2010, we missed a lot of people. And unfortunately, a lot of those people that we missed were kids. And that causes a lot of problems. If we don't have an accurate count of how many people live in every city, town, and state, and where they live, then the government doesn't know where to send its resources. And so the people who need those don't get them, and people suffer because of that. So it's important for each and every one of us to make sure that we get counted. Now, adults do this by completing the census, and you can complete the census online, or by mail, or by phone. And we will be sending out some information later to everybody in order to tell you how to complete the census. But it's our responsibility to make sure that we get it done. And it's important for everybody to remember that the census is completely anonymous or confidential. What that means is that there aren't any organizations outside of the government that can get this data. And just as importantly, organizations within the government, except for the census itself, can't get this data either. This information is only used for counting how many people live in this country and where those people live. And so it's very important for all of us. In fact, the government uses this information from the census to know where to send research money in order to develop vaccines and distribute them. So in fact, having an accurate census will help us fight the coronavirus or other viruses that come along in the future. All right, well, I think I've spoken enough for today. I haven't been checking my phone, but Leanne has, so I'm going to find out now if we have any questions.
Hi everyone, I'm Leanne McAllister. I'm Dr. McAllister's wife, and I'm the Executive Director for the Nevada chapter of the American Academy of Pediatrics. And I have a question.
All right.
So how come it seems that some people who catch coronavirus get really sick and other people don't really seem to get sick at all?
That's a good question, and it's hard to answer. There's no one simple reason for that. The way that our bodies react to different viruses and vaccines is different for everybody. It depends on a lot of factors. The strength of your own immune system, the type of white blood cells that you have in your immune system to help fight the infection, and just the overall health of your body. So everybody reacts a little bit different. Not just with coronavirus, it happens with the flu, for example. Some people get the flu and only get a little sick from it. Other people get the flu and get very sick from it. We do know with the coronavirus, certain people are at higher risk for getting very sick for it. These are people who are older or who have underlying conditions, who have problems with their lungs or their hearts. So those people are at higher risk for getting sicker from it. But again, it comes down to a very individual response of your body to the virus, and everybody reacts a little bit differently. Any other questions?
So a lot of kids want to know why they can't play with their friends right now.
That's a good question too. And that gets back to the first superpower that we talk about, staying away from other people. Now, you may think that if you're feeling good, you're not coughing, you don't have a fever, you're not sick, and your friend's not coughing, doesn't have a fever, he's not sick, so why can't you play together? Well, here's one of the problems with this virus. We do know that people can get this virus, get infected by it, and spread it to other people before they show any symptoms, before they even know that they're sick. And so you may have the virus right now and not know it, and if you go and play with your friend, you can pass it to them. And that's the last thing you want to do, is to get your friend sick. Or your friend, if they have it and don't know it, they don't want to get you sick either. So until we have this vaccine, until we have a better handle on this virus, the most important thing to do is to keep away from people, even if they seem to be very healthy at the time. And anything else?
Yeah, so a lot of parents want to know, what do they do if they think they are sick or their kid is sick? Do they just come right into your office? Do they go to the ER? What should they do?
Yeah, that's also a great question. So the emergency rooms, the hospitals, and the doctor's offices, we're all open, and we're there to take care of people who are sick. But you're right, you don't want to just rush in, because you don't want to get it potentially exposed to somebody else who has the virus to spread it to you. And so we're asking people to kind of take a step back. If you are really sick, you can definitely call your doctor to find out if you should come in. I can tell you, for example, at my office, we are keeping the healthy kids, so the kids that come in for their routine checkups or for their vaccines, we ask them to come in the mornings. And then children who are sick, we ask them to wait and to come in the afternoon. That way the healthy kids aren't getting exposed to the illness from the sicker kids. We're also doing something very similar to what we're doing right now. We're doing a lot more medicine online, or what's called telemedicine. And so parents can call in and they can talk to me and they can see me through the computer, and I can give them medical advice, or I can help them figure out why somebody is sick and what they can do about it. So that way I can help a child get better, but they don't have to come into the office to potentially get exposed to something much worse. So the most important thing before you go into the doctor's office is to call. So call the doctor's office, or call on your insurance card. Most insurance plans have a nurse advice line, and usually the number's on the back of your insurance card. You can call them as well to get advice of what you can do at home, or if you really are sick enough that you should go into the emergency room. So just call first. That's the most important thing.
And we got a live question from Brendan, who wants to know if there's any guidance from anybody on when social distancing might end.
Okay? Yeah, that's a good question, and that comes up a lot, and that's what everybody wants to know, because we all want our lives to get back to normal. And there's a lot of positive signs going on right now, that the rate of new infections is starting to drop, at least in parts of this country. But for now, we're not sure what that means. We're not sure how long that's going to last, or when that's going to get down low enough that it is safe to stop social distancing. So the most important thing right now is to listen to the experts. There are very smart scientists and doctors in the Centers for Disease Control and other government agencies who are looking at this data very closely, and who are going to help us know when it is safe for us to stop social distancing. Right now, it's not. Right now, we got to continue keeping that distance. And I can't give you a date or a time of exactly when it's going to be safe to start interacting with people again. It will be, but we just don't know exactly when yet, so we have to listen to the experts on that. All right, any other questions? All right, I'm getting a no. There are no other questions. So thank you, everybody, for joining us here today. Now comes the part of our monthly meeting where we go for a walk, and we're going to do that again today. But we're going to do it a little bit differently. I'm not going to walk with the camera on me, because I will trip and fall and hurt myself, and I don't want to do that. So we're going to turn the camera off in just a minute. My family and I, we're still going to go for our walk. We're going to take pictures of ourselves along the way, and we're going to post those pictures on this closed Facebook groups to share with you. We'd encourage everybody else who's out there today to also go for a walk with your family. Go for a walk, go for at least 20 minutes. Try to stay 6 feet or more away from other people, but get outside, enjoy the beautiful weather. All right, so, and then we'll meet again in a month, in May, for our next Walk with the Doc. We will probably be doing it just like this again, but we'll let you know when we get a little bit closer. All right, everybody, go for your walk, have fun, stay safe, stay healthy, and we'll see you next month. Goodbye.